Welcome to Dr. Balga's podcast for the Curious Doc. Today is 27 May 2026. This video is on a New England Journal of Medicine article published online today titled Stem Cell Derived Biologic Ventricular Assist Tissue in Heart Failure. There were two accompanying articles, one titled Remuscularizing the Failing Human Heart, the Science Behind the Study, and the second was an editorial titled Patching Up Damaged Hearts, all in the New England Journal of Medicine. Heart failure with reduced LVEF is characterized by irreversible cardiomyocyte loss and fibrosis. BioVAT uses engineered heart muscle derived from allogenic induced pluripotent stem cells for cardiac remuscularization. This is an open label phase 1-2 BioVAT heart failure trial conducted in Germany. 20 patients with symptomatic heart failure and LVEF less than 35% underwent transplantation. BioVAT comprised 5, 10, or 20 engineered heart muscle units containing approximately 34 million cardiac myocytes and 6 million stromal cells per unit. Mean age 59 plus or minus 10 years, 88% were male. Mean LVEF was 25 plus or minus 7. Median NT-proBNP was 1422 nanograms per liter. Primary endpoints: target wall thickness, LVEF, Kansas City Cardiomyopathy Questionnaire overall score at 3 months. Mixed model repeated measures analysis was used. What did they find? Among 16 patients receiving maximal dose, target wall thickness increased by 4.5 millimeters, p-value less than 0.001. LVEF improved by 3.9 percentage points, p-value equals 0.04. Kansas City Cardiomyopathy Questionnaire overall summary score increased by 6.7 points, p-value equals 0.06. 3 deaths occurred but were adjudicated unrelated to BioVAT. All patients experienced adverse events. 57 had serious adverse events. Limitations of the study: open label, non-randomized design, small sample size, limited female representation, competing risks from death and transplantation, and there was the need for chronic immunosuppression. Key takeaways: BioVAT demonstrated feasibility of myocardial remuscularization with improved wall thickness, modest LV function gains, and acceptable short-term safety. Long-term randomized studies are required. What did the editorial perspective say? It was titled Patching Up Damaged Hearts. It emphasized that BioVAT represents a first-in-class regenerative strategy for ischemic cardiomyopathy using modular engineered heart muscle patches. Strengths highlighted: patients had advanced heart failure despite optimal GDMT, including beta blockers, angiotensin receptor neprilysin inhibitors, ARNIs, MRAs, and SGLT2 inhibitors. Surgical implantation via minimally invasive thoracotomy avoided cardiopulmonary bypass. The editorial insight: 20 engineered heart muscle units corresponded to nearly 800 million induced pluripotent stem cell derived cardiomyocytes, representing a biologically meaningful intervention compared with adult ventricles estimated to have 2 to 4.5 billion cardiac myocytes. Editorial concerns: open label design may introduce bias. Only 3 women were enrolled. Functional exercise capacity and 6-minute walk did not improve significantly. Long-term durability and integration remain uncertain. Future questions: can engineered heart muscle achieve better electrical coupling and mechanical integration? Can autologous tissue eliminate immunosuppression? Why were arrhythmia rates lower than prior stem cell approaches? Science behind the study, titled Remuscularizing the Human Heart. BioVAT induces pluripotent stem cells differentiated into cardiomyocytes and stromal cells embedded in collagen type 1 hydrogel to create contractile engineered heart muscle patches. Mechanistic basis: therapy acts as a biologic ventricular assist tissue rather than a mechanical device. By increasing ventricular wall thickness, BioVAT reduces wall stress according to Laplace's law and may improve performance. Engineering design: hexagonal engineered heart muscle units are stacked and sutured onto a hypokinetic ventricular region. Each patch becomes vascularized and structurally integrated with host myocardium. Electrophysiology: prior large animal studies have demonstrated risk for engraftment associated ventricular arrhythmias due to electrical immaturity and incomplete coupling. Dose escalation strategy aimed to minimize arrhythmic complications. Regenerative medicine significance: BioVAT advances the translational arc from induced pluripotent stem cell discovery to clinically implanted contractile cardiac tissue, representing a major milestone in human cardiac regeneration. Clinical pearls: BioVAT is designed to remuscularize scarred myocardium rather than merely support circulation mechanically. Increased wall thickness may reduce ventricular wall stress and adverse remodeling even before full electromechanical integration occurs. Arrhythmogenic risk remains a critical issue in stem cell therapy, though rates in BioVAT were lower than prior cardiomyocyte injection studies. Immunosuppression remains necessary for allogenic engineered heart muscle transplantation and contributed to renal dysfunction and treatment discontinuation in several patients. This study represents one of the first clinical demonstrations of stem cell derived engineered myocardial tissue, improving structural and functional cardiac metrics in advanced heart failure. This is an infographic on this NEJM article. Hit pause and read at your leisure. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.